Hello, everyone, and thanks for listening. So, I've seen a lot of craziness just within this week alone. And I know this is not the title of my video, but I have seen a lot of craziness involving the shooting that happened in Parkland and all of the arguing over whether they should arm instructors, teachers with guns. Of course, those teachers that they would train to use guns, and I can tell you that sounds like a horrible idea. And I guess I'll explain that later, and I'll probably, you know, um, add that in. Maybe I'll add that in this video. But I wanted to talk about disabled people having to show valid proof, or they would be required to work. And I stress that valid proof. And so, under the Trump administration, there's a new um, development that has come about. And I know I've seen this several weeks back that in Trump's new Medicaid work requirements, that it could be a disastrous situation for people who are in this category. And so I thought this was a perfect article that explains how this could be a real big problem for people who have disabilities. And so there's a work requirement for people who have no proof, no real proof whether they have a disability or not. So I'll explain here in this article. It talks about in the letter to state that Medicaid directors Thursday morning that the Trump administration announced that it would allow states to require Medicaid recipients to participate in a work program and another form of approved community engagement. So in order to retain the health benefits, so if they want to retain their health benefits, they have to be in a work program. So I'm kind of paraphrasing as I go along. So while there was supposedly um, there would be exceptions for disabled people, allowing states to implement work requirements. That would be here in this article. It says it's a terrible idea, and why. It says, as a disability lawyer, this person wrote, or his reasoning would be that a disabled person such as himself, he says he knows that this policy change, it'll be a disastrous one for people in the community. A number of important ways that he points it out. He says the first concern involves eligibility process, which this is a problem even here in California. So I've heard people that I've known go through a process of trying to apply for disability, and you have to show proof, but there's a lot of things that you have to go through, and it has to be valid proof. And so in the course of that, it could take a lengthy period of time just to show that you qualify. So here in this article, it goes on to say similar situation, but it would be worse under this new policy. It says, according to the Washington Post, the states will be able to decide for themselves now who qualifies as disabled or a disabled person. So for the purpose of being exempt from the work requirement. So in other words, if you want to be exempt from the work requirement, depending on your circumstance, that whatever your state or the city you live in, they have their own requirements of who qualifies under that disabled uh, label. So no matter how broad they define the category, there'll be disabled people who will not qualify for the exemption, even though they should. And so this usually tends to be a big problem for people who have disabilities. Even though you may have a disability, sometimes showing the proof is very difficult, or it's time consuming just showing the proof, and your health could deteriorate over time just going through this process. So I'm just going to try to go through here, which they make a really important point, and I've heard people go through this problem And so it could be a disastrous situation for a lot of people, especially people who don't make a lot of money. And I mean, automatically, you're not going to make a lot of money if you have health issues. You're probably not going to be in a position where you can just work. So most employers don't want to take a risk at you getting hurt on the job if you're already coming with pre-existing illnesses. So here it's saying that I know this from experience. This lawyer, he says, indeed, in my role of as an appeals lawyer for people applying for Social Security disability, I often deal with similar problems. So Social Security Administration acknowledges that the standard for Social Security disability eligibility is very strict. So many people who eventually do qualify for benefits have to go through several appeals that can take many years. So that's time consuming right there alone. And even if the standard for Medicaid rather, would work requirement exemption is much more lenient than the standard for Social Security, it still grants the state the mechanism requiring people to fight for coverage. And so that's coverage they should be entitled to. While this appeals process plays out, people are likely to get even more sicker during that process and more disabled as they await the final decision. So, in the end, many people could become stuck in that gray area, waiting in limbo. And so it goes on to say, too sick or disabled to work, but not sick or disabled enough to be exempt from the work requirement. So, that's another issue. His and her special needs, the only way to get out of this in between space or gray area is to eventually become more sicker or more disabled and will be much more expensive to the state if they survive it, depending on their health issue. So this would be compounded if you don't have the type of disability that can be easily quickly diagnosed, such as a mental health illness. May take longer to take testing and evaluations before they can figure out what it is that is wrong with you. And in that period of time, you can become more sicker or more ill. And therefore, it could be a costly process, very time consuming, and then very stressful. And it can also be stressful on top of not having the financial means to be able to support yourself or be able to pay for the cost of the visits to see all these doctors. So there's other illnesses that sometimes people can't actually visually see. So they call them invisible illnesses, or things that could be going on. It may take more time to detect what those are. So, for example, this person says he has an autoimmune illness. It took him years of testing and specialist visits to be diagnosed. And so, if that were reliant on Medicaid in the state with a work requirement, I would have to pay for years of testing and doctor appointments myself, and before finding a doctor willing to sign off on a work exemption form. And so this is what people who have disabilities are faced with, and it could be a costly one. So it says people whose income allows them to be eligible for Medicaid almost certainly cannot afford upfront costs and fees for these doctor visits and diagnose, visits and stuff like that to just diagnose people. And so it may take more than several visits before you get diagnosed. Therefore, it's a big problem. So it says the change in policy will also exacerbate health inequalities that are already a massive national problem right now. Medicaid is a means-based program, meaning that only low-income people or people who have income cutoff varies by state. It will affect or will be affected by the changes. So the increase in the access requirements, no matter what those requirements entail, will necessarily reduce the number of people who are able to access Medicaid. So any additional requirements will serve to make people who currently are eligible for Medicaid ineligible. So in other words, less low income people will have access to health care. So this is why they have this big argument over the healthcare issues right now. So more low income people will have an even worse health outcome. And so it goes on to state that the states that will end up implementing these work requirements are almost mostly the states that tend to be the poorest to begin with, such as Kentucky, the fourth poorest in the country, Arkansas, the sixth poorest, and furthering the unconstitutional poverty and negative health outcomes associated with it. So if it seemed like deja vu, that's because in 1996, President Bill Clinton signed the Personal Responsibility and Work Opportunity Reconciliation Act. And so the law overhaul America's so-called welfare program, and it included a new work requirement similar to the ones that are being discussed right now. So it had devastating consequences for most vulnerable people because as access to benefits decreased, extreme poverty increased. So this is what is really got a lot of people in an uproar right now. So these negative outcomes will happen again with the Medicaid work requirement, except on top of poverty, untreated health conditions will also likely drive worsening health outcomes up to the including also death of people. So it doesn't take a political scholar to understand that this is yet another attempt by the Trump administration to eliminate the modest gains in health insurance coverage made by the Affordable Care Act. Around 60% of the working age non disabled recipients of Medicaid are employed. So that in addition of a work requirement, it moves us further away from the idea of the healthcare as a right and towards an American uh, uh, ideology that it does not provide a safety net. In other words, for the most vulnerable, including people with disabilities. So this writer goes by the name of Katie Strom, and she's attorney and activist in Syracuse, New York. And so her work has been published by the Slate, Ravishly Every Day, Feminism, among others. And she especially loves writing about living with chronic illness. So I take it that the person that is the writer themselves, they also suffer from their own health issues. So I heard about this, not even just from this article, but earlier. So it's Trump's new Medicaid work requirements are a disaster for disabled people and everyone else. And so it sounds like there's some other things that are brewing, and it's going to affect a whole lot of other people here in the states of America. And outside of this disaster that happened with the school shooting, which is very traumatic, an incident that has brought about a lot of controversy. There's also other controversies that are slowly brewing, and this would be one of them, having to do with the healthcare issue of Medicaid and people with disabilities, and just everyone else, you know. So I just thought I would bring it out because it just seems like when you thought things could not get any worse, and lo and behold, it has. So anyway, so I'll just leave in a smidgen of my thoughts on the the whole thing with the teachers being armed with guns. That's a horrible idea. And I'm just looking at it from the standpoint of view as an educator myself and somebody that has worked in middle school and worked in high schools. That's a horrible, horrible idea. And, you know, teachers have enough things to deal with. But on top of that, sometimes you'll have parents that are difficult. You'll have students that are difficult, as we already witnessed. Unfortunately, he's not the only one. There are other students out there that have, you know, mindsets of, you know, plots of what it is that they may want to do to another kid or to a staff member. Um, it could be a number of things that could happen. But this right here, you know, to make the decision to arm um, and teachers with guns may be a horrible idea because we have that incident where the teacher was saying to the students how he didn't think that students that were put in the armed first forces, their parents loved them. And then they had a parent that was picketing outside of the school. If you remember that far back, then we've had several teachers that have gotten caught with pornography. You don't know which ones of those teachers there are that are involved in that. Can you imagine one of those teachers being equipped with a gun? And it the pornography was child pornography, of course. And so could you imagine one of those teachers with a gun? I'm just throwing these ideas out here because those are things that I don't think that maybe he's thought about. Sometimes teachers don't get along with other teachers. They may not get along with other staff. Um, there could be days that a teacher may be having a really horrible day. You know, there's a number of things that could go on. Sometimes teachers can make, um, you know, uh, bad decisions. Also, because they're human, and you could mistakenly think that another student is doing something, and the student may not be the one that is the one doing whatever it is you think that they're doing, they shouldn't be doing, if you get my drift. But there's a lot of bad could come out of that as well. It's just, I think that if there is a such thing as that, I don't think that all teachers are uh, a group of teachers. I think something like that should be like left up to, like, maybe there should be a special assigned security enforcement, or a little security area where they are stationed at a specific districts, and then they're called to go to or be close by to those school districts in the event of emergencies, depending on what school it is, if they have a high incidence of those type of problems. But that's my take on it. I mean, maybe somebody else sees it a different way, but it has really gotten out of control lately. So I don't know. With that being said, I guess I'm going to cut this video short, and I'll probably do another video. But just seems like it just, when you think it couldn't get any worse, you don't even want to say that anymore nowadays. And it just seems like it does each day. But anyway, thanks for listening.